to a bucket to a mug and human body. So are you durable? We all believe we are. But in terms of molecular, in markers, molecular ways, do we know we are durable? We do not know. And that's where we started to understand what makes us durable, what makes us resistant to deterioration and death. Death, which is miserable death or a happy death, you can choose that trajectory. And that's where we started. But we realized that to understand molecular basis of aging, we don't even have Indian data. So you talk, we're going to work about Indian, how to live happily for a long time, we don't have data. So that's when we started an initiative, a project under Longevity India, which we call nicely, Amrit was one person who actually gave a name, it's called the Bharat study. You might say Bharat is, you know what Bharat is, India is Bharat. Bharat is biomarkers for healthy aging, resilience, adversity and transition. And these are the changes which undergoes in our body as we get old. And we are trying to capture that signatures. We want to capture you at a molecular level, that when you get old, what changes in our body, especially in a context of India where language changes every 80 km, food habit changes every 100 km. The West, nothing changes. Once you travel West, you realize all towns look the same. All food tastes the same, actually it tastes bad same. There's no diversity in life there. But we are here, we're a rich, diverse country. So we need that diverse data set to be captured. Now we started with that ambitious journey. We start capturing data and we realized, oops, we made a mistake. We started at a point that we do not even know what the local rules of the game are. If I want to look at healthy people, they are not going to come to hospital. I'm so sorry, they're not going to come to hospital. Right? They're going to be there in the community. They're going to be here in village, or even taluk. You have to reach out at community level to collect data. That means I cannot work with my hospitals, but I still need ethical approach of hospitals, so that's why you are here. I'm sorry. But the idea is, clinicians will tell you whether you're fit or not, you're healthy or not. So we take clinical partners who work with us. Carol is right there. She's another culprit in trying to reach out to healthy people. But the idea is to reach out to people who are healthy. And clinicians say you are healthy. Then we onboard you, collect a lot of data. Now data in healthy people in India is going to come in very interesting flavors. Right, from dal makhani flavor to batata flavor and sambar flavor. What I mean is, our language linguistics are very different. So when people say I'm happy, I'm healthy, they will be giving data in their local dialects, local narratives. We need to capture that. And ARCA had strengthened that domain. So it looks like, he calls it marriage, I refuse to call it marriage. I call it...
Take us to the next level of patient care, of patient engagement, of clinical outcomes, impacting clinical outcomes, positive clinical outcomes in the areas where we have expertise in. And will also help shape our expertise into a newer level, especially with medical education, with grooming new minds into areas and into methodologies which will help them work faster, more efficiently, reach out to larger populations. And that's going to be key to health in future, because we all know India struggles, Kerala is one of the most, luxurious state as far as access to doctors and nurses are concerned. But still we struggle with not being able to reach out to the, tribal areas, to much of the, many of the outskirt areas. I'll just briefly introduce myself first. My name is Rosie Marcel. I represent Believers Church Medical College Hospital as the Chief Administrative Officer. I have this interesting start of my career in technology. Worked with IBM in the beginning, very early of my career. But for the last 20 years, I've been associated with healthcare, with hospitals, working models, operational models, financial models, aimed at high quality.
So we, I think in the next few months are going to experience something that healthcare has not really seen. It's a collaboration, it's a partnership that I believe will take a long, long way in what we envision to be preventive or primordial care. It's medicine 3.0, like how Dr. Saini called out today. And ARCA's vision to actually have collective intelligence and it actually being available in the rural communities of India as a goal is going to be established with this partnership. We have Believers Church Medical College today who's committed to the cause in Kerala. We are hoping to have many more hospitals who take up this drive in Bangalore, outside Bangalore, in any parts of the city that we can actually be with, collaborate with IఐESA in this program together, and actually contribute to the larger cause, which is to see how an Indian village and once contribute to that can actually pharma enable better patient care, precise medicine, precision medicine to the world. And that's something we are very openly looking forward to from our side. And ARCA is committed to the cause, to security, to privacy of the data, to actually ensure that it's delivering the right value from a data standpoint, to making sure that we are responsible for it, to ensuring that the community gets it, the community gets the care with the data, and it's research oriented. It should not be just hearsay, it should be with science, and that's what we assume that we will be able to bring to a table. In the coming months, we'll have more announcements of this nature. We have multiple other partnerships in the line that ARCA is actually working with that adds more value to this cause.